Good morning, everyone. Welcome, and we're glad you're here. We're just going to give everybody a few minutes or a few seconds to get in, and we'll start momentarily. Welcome and good morning. Good morning, everyone. Welcome. We're so glad you're joining us this morning. We're going to give everybody just a few more seconds to log on and get here, and then we'll get started promptly. We have a full agenda for you and want to make sure we give time for everybody to speak, but we'll also make sure everyone's here. So again, welcome everyone. People are still popping into the webinar with us. So we're going to take a few more seconds. We'll be starting shortly. All right, well, people are still coming in to the webinar, but we are going to go ahead and get started, knowing that we have a packed agenda and lots of great information to share with you all, and an important and timely conversation to have today and get us started thinking about how race equity has affected our early childhood community, both to access and to our access to our children and families, as well as for our early childhood workforce themselves. I hope you all have a good warm cup of coffee ready. It's chilly here in Texas, which we are all very thrilled about after a long hot summer. So welcome fall and welcome to you. My name is Kim Kofron. I am the Director of Early Childhood Education here at Children at Risk, and we are thrilled to be having this conversation together. We have pulled together some amazing panelists from across our great state and across the country to give us insight into the work that has been done thus far, as far as when we think about equal access and equality for our families and our children and our workforce, as well as the work that is yet to be that's happening currently and the work that is yet to be done. Just to give you a quick overview of the agenda, we will start off today with Christine Johnson Staub to give us a brief history of where our early childhood roots are in the equity work. We'll then be joined by a panel of researchers that have done some work here in Texas with us as we dig into where we are in Texas with this work. Then we'll dig into the workforce and what does the race equity will look like for our early childhood workforce with the panel. We'll hope to take a quick 5-minute stretch break halfway through. I all know that a lot of us sit at our computers a lot throughout the day, and we want to get up and make sure we are moving around just a little bit throughout the session. Then we'll come back together and talk about access to our children and families, and making sure and having that conversation. And then we'll look at our policy work, what's happening at the federal level and what's happening at the state level and where our role is. And finally, we're going to look at where we are as individuals and how do we continue to move our work forward, knowing that self-care is important when we have these conversations. Our MC today is going to be our very own Sharon Jones. Sharon is the director of Texas Racial Equity Collaborative here at Children at Risk. Her career has included positions of leadership in public affairs and higher education administration. She is the former director of political strategies at ACLU of Texas and director of career and technology education at the Lone Star College System. She's the owner of Watkins Jones political consulting firm, and we are so glad that she is going to be moderating us throughout the day, and we'll be able to, and I will join you at the end of the event and to touch base at the end. Sharon, the mic is all yours.
Thank you so much, Kim. When we talk about racial equity, we're talking about the condition that might be achieved if one's racial identity was no longer predicted in a statistical sense as to how we fare in life. When we use those terms, we're thinking about racial equity as just a piece of racial justice. And so we're also going to talk about the work that addresses the root causes of inequities and not just how they come about. So today, we're going to pick up the prism of racial equity and early childhood education. We're going to turn it and look at it at all angles. An equitable child care and education system supports all children's health and development, including their social and emotional development related to a child's cultural, racial, and linguistic identity. So we've gathered experts here to discuss the history of childcare in America and the impact structural racism has on today's early childhood workforce and next generations. So we're going to explore how racial disparities affect children's access to quality childcare. And additionally, advocates for children will share research and best practices for creating racially equitable early childhood policies that address structural inequities in access, quality, and the early childhood workforce. So we know it's not easy to think of and discuss racial disparities that hinder and hurt children who are our most vulnerable population. And it's definitely not easy to dismantle systems that keep these disparities in place. But it's so much harder for children and families to live and thrive within these systems. So talking and working is what we have to do. So I encourage you today to listen with your ears and with your heart, take mental note of what makes you uncomfortable to hear, and be reminded of the discomfort felt by those who experience it in their lives on a daily basis. So let's get started on this journey to help children for whom early education is the launching pad for success. Our first speaker of the day is Christine Johnson Staub. She's a senior policy analyst with the Center for Law and Social Policy for CLASS Child Care and Early Education team. Her work is focused on the state early childhood systems, child care subsidy programs and policy, and racial equity in early childhood systems. She helps guide CLASS state technical assistance as well as its work on financing and linking systems. Welcome to this program, Christine. We're glad to have you. I know you get the stage for us as we begin this discussion and walk us through the history of racial inequities in early childhood, allowing us to understand the work that lies ahead.
Thank you so much, Sharon. I really appreciate being here, and I appreciate being included and invited. It's really exciting. For those who aren't familiar with CLASP or the Center for Law and Social Policy, I'll just do a couple of quick moments on that. If you could go to the next slide, please. So CLASP is a national nonpartisan anti-poverty nonprofit, and we work exclusively on policy solutions that impact low-income people. We work on both the federal and state level, and I think one of the roles that we really try to play is translating federal policy for folks in the states so that they know what their options are and they have good examples and good interpretation of the current laws. And then we work at the state level on federal policy implementation and also take back to the federal level what we learn from working with states, with state agencies, with advocates, with organizers, with community members, with providers, with parents, with who, with all of the folks who we have partnerships with, so that we can improve federal policies overall and make them more equitable. We approach all of our work centered around racial equity and with a multi-generational approach. And we have done a lot of work over the years to really strengthen that focus on racial equity, to really make it, to really put it at the center of our work, including increasingly working on ways to center policy development on the lives of impacted individuals. I would say we started this conversation specifically around childcare and early education, actually many years before this, and working on immigration policy and thinking about language access and thinking about and looking at data around who has access to childcare and who doesn't. But we released Equity Starts Early, which was kind of a foundational document, in December of 2018. And included in that, that was the first time I think that we really on paper took a hard look at what the history of our field is, and the history of the policies that we work on, that we protect, that we promote, and how they are infused with racial inequities and racism. If you could go to the next slide, please. So this is a really nice timeline that just shows kind of how racism and inequities have been rooted in the history of policymaking around childcare and early education. Really, it goes back to the days of people who were enslaved being asked to care for or being required to care for people's children, white people's children, and the roles of people of color, Black people, Latinx people, and others in the caregiving role and the caregiving occupations. That was really kind of codified in the 1938 labor policies, the Labor Standards Act, which advanced some significant labor rights for individuals in the workforce, but intentionally left out things like domestic work, caregiving work, agricultural work, and other fields that were predominantly people of color. We have other milestones on this timeline that are significant. I would say the bright light on it is the 1965 passage of Federal Head Start, which really started looking at some of the root policy design questions that could make early childhood more equitable by focusing on community decision-making and planning and needs assessment and leadership of parents and providers. So we returned to Head Start over and over again as kind of a touchstone of, we know how to do this equitably. We know how to have families and providers take the lead and communities define what they need. And that's at the root of making more equitable policies. The other thing I would highlight on this timeline are two more things. One is people often, especially right now, are focusing, as we talk about a potential entitlement for childcare, people focus a lot on the Nixon veto when universal childcare was proposed by Congress and then not completed because Nixon vetoed it. And that was definitely a significant setback. But even since then, in the creation of the childcare development block grant and TANF-related childcare for access for individuals who are receiving cash assistance, those policies under the Personal Responsibility and Work Act, PERORA, which I'm not going to completely unpack that name, those policies really were embedded and infused in the conversation around welfare at the time, and that was very racialized and very biased. If people were around then and remember the conversations around welfare queens, those kinds of stereotypes and misrepresentations of people have created lasting barriers based on scarcity of resources, limited investment, really based on keeping people out, based on the worthiness of individuals, whether they should receive not just cash assistance, but childcare assistance and healthcare and nutrition and all of the other things that are related and that people need as basic needs. And those federal policies have influenced state policies. And so when we look at our state policies and we look at the inequitable outcomes of them and also the inequitable design of them, they're very much rooted in we don't want to. They're very much rooted in fraud, in stereotypes about, in racialized stereotypes about fraud, in expectation that people are going to try to take advantage of the system that's based on those stereotypes, and in limiting access. So when you see state policies, for example, that that require an immense amount of documentation, an immense amount of work hours, tying childcare access to individual work schedules, all of those things are really designed, first of all, aren't required by federal law anymore, but are kind of legacy policies in many states that were designed during this time of, which really continues, of thinking about who is worthy of receiving childcare and who isn't, and how do we keep people out and keep them from quote unquote taking advantage of the system. All of those conversations were really launched by the racialized stereotypes and the welfare queen kind of what's the word I'm looking for? Scapegoat. So that I think we can go to the next slide. So those roots of policy and that history of policy really feed into the outcomes that we see now. And CLASP has done a lot of data work, but also, I think we work with states and encourage states to look not just at numerical data, but at qualitative research about who is accessing childcare and who isn't. In thinking about what we know about who has access to childcare right now, childcare is least affordable for Black and Latinx families with low incomes. Native American and Latinx communities are much more likely to live in childcare deserts, which is, also an inequity that's tied to geography, which is not what we're talking about today, but there's if you take an intersectional approach to really designing childcare policies that will reach families equitably, you have to think about not just racial barriers, which override everything, but geographic barriers and other socioeconomic barriers. Childcare workers, we know, are predominantly women of color, and we know that they are chronically underpaid and undervalued. And again, going back to that history of being tied to people who were enslaved doing childcare work for the houses that enslaved them, and then moving on to domestic workers and caregivers being excluded from labor standards. We continue to systemically undervalue the work of women that is predominantly done by women of color. So women of color are disproportionately childcare workers. I think if you look state by state to data and access, it's not always the majority of childcare givers and educators are women of color, but disproportionately women of color are this field. And that makes it, honestly, within the context of systemic racism, makes it easier for people to justify paying low wages, not paying benefits, not having job quality, not caring for workers. So a lot of what we're talking about now in the COVID era is the mental health of workers who are really expected and required to continue to work under conditions that put their health and their family's health at risk. So all of those things feed into what are our expectations of people based on race and based on other factors. And again, Black and Latinx childcare workers are more likely to be employed in lower level positions in childcare programs. So not only is the field disproportionately Black women and women of color, it's a stratified field. They are most likely to be in the positions that pay the lowest. And often the positions that pay the lowest are some of the positions like infant toddler teachers who require the most intense work. And so that's another kind of root inequity of the system. Next slide, please. We have done a series of reports, not very recently, we haven't updated in a few years, mainly because of the pandemic and because of the way that's skewed the data. But this is some findings from our report on inequitable access, which has state-by-state numbers, including for Texas. And what it shows is that, so one caveat for this data is that it does not include access to Head Start and to state pre-K programs. So, but what it shows is that Hispanic individuals in particular, Latinx people in particular, and Native American and Asian families have the lowest access to childcare. Particularly when you look at state eligibility parameters. So we looked at what does access look like under federal, and what's allowed under the federal law to subsidies, and what is and what does it look like under state eligibility under subsidies. And this is all access to childcare assistance, not access to childcare. So those are two different things, I realize, but this was one of the pieces that really highlighted that, in particular, Latinx families and Asian families had particularly low rates of access across the country. Next slide, please. So when we approach the work on childcare and think about how do we address this at a root level, how do we turn the corner from the historic racially charged development of childcare policies and early education policies and the inequities that they've resulted in and that they continue to result in, and how do we make it a more racially equitable childcare and early education system? There's a lot of opportunity for these conversations happening now around relief, and there's also a lot of these conversations happening around the design of the proposal that Congress is currently considering. So we at CLASP have talked about some principles of equity in early childhood and things that kind of drive the work to make it more equitable. One is to really use data to understand as much as you can the demographics, language needs, geographic differences, differences in utilization, differences in access, how different state policies and federal policies impact people differently. And we can use numbers to do that, but I want to refer to some work that I'll share after I'm finished from my colleague, Alicia Hardy, who looked at data and stakeholder outreach and how racialized that and inequitable those processes are in our regular work. So even using research or data, you have to really think about who created the research, who created the data, what processes did they use, how deeply did they work to ensure that the data that they were collecting was capturing all individuals equitably. And then how is that reflected in the data that we have? And so if just for a really easy example, if you think about how much we use census data, which is really kind of the best data source we have nationally, how much we use that in our work, and yet how many people we know have been left out of the census process, both because of how census data is collected, because young children tend to be left out more often, because non-English speakers tend to get left out more often. So census data, which is again probably our best source that we know of, is really not reflective fully, and so if you rely only on data, then you can really reinforce the inequities that are already in the system. Because of that, we encourage policymakers and advocates and others to really lead with the voices of those who are impacted and collect qualitative data to really paint the full picture of people's experiences and making sure that everybody's voices are being heard. So leading with the voices of those who are impacted, both in defining the problem and designing the solutions. So what does that mean? That means at the tables where policy is usually created or historically created, do we have representation? Do we, are those tables themselves designed equitably? So when your legislature, and I'm just pulling this out as an example, I'm not talking about a specific Texas thing, but when your legislature creates a commission on early childhood and they say, here's who has to be on that commission, are they saying, we want one parent and expecting that parent to represent the full experience of parents? Or are they saying, we want to ensure that we have an equitable process of stakeholder engagement that will reflect all of the different experiences of parents in Texas? And that's the kind of difference in that will lead to the difference in both defining what the policy problems are, what the barriers are, what the inequities are, and in designing solutions that will actually work for communities. So in short, if you're not talking directly to communities, you may create solutions that you think are equitable, that you think are going to reflect what people's experiences are and help get them access to childcare. But unless you've actually listened to people who are experiencing those barriers and done that authentically and systemically and consistently, the policies you end up with are going to be missing that point of view. And that applies not just to childcare, but to all of the other policies that interact with childcare. So in every question and every potential policy solution, we have to be thinking first of who is at the table, who's in the conversation, who's telling us their experience, and then go back with a systemic loop of feedback to communities to say, here's what we heard you say, is this right? And try to do this process enough with parents and providers to know that people are saying, it's hard for parents to participate in policy conversations, right? Because tables, you can invite people to the table, but if you're setting a table that is not accessible to people, they won't be able to participate. So we have to not just rethink who's defined in those tables, but what do those tables look like and how do they operate? Are they happening in communities, in the languages that people speak, with the, compensating people for their time so that they can participate without losing wages, making sure they have access to childcare for those processes. It takes a lot of work, and it's not just about inviting someone. So I want to make that really clear. So it's a big commitment, and but it changes completely the conversation that you have about what the experience is around childcare or any other related policy issue, and what the potential solutions are. And then, I think part of that, as we really commit to anti-racist policy, part of that is also that it shouldn't be about how are we engaging people in this conversation, but it should be led by people that reflect the full diversity of the community. And that's, many more conversations about elected office, about community leadership, about valuing the experiences of people who aren't elected or appointed or have different education levels. So I think actually I want to skip to, I'm going to include these, you're going to receive all of these slides, but I think we're skipping to slide 9. I wanted to say just a few words. I think I've got enough time to do this, right? I've got a timer going, so hopefully I'm right. I want to say a few words about scarcity thinking, and just highlight that if you haven't contacted your members of Congress yet, please do it today, because they are deciding in the House what they're going to move forward on in terms of Build Back Better and the investment in childcare. But I had to put the $450 billion in federal dollars for childcare and pre-K at the top of the list, because what drives so much of our racial inequities and structures is the scarcity of dollars and people deciding who gets to get those dollars. And also that the states that are most challenged by revenue may have the hardest time meeting matching requirements to maximize federal dollars. But we need advocates and parents and providers and organizers to really focus on making sure that their states are meeting the matching requirements to maximize their federal dollars, and that they participate in the federal opportunities that come down. I will just as a note say what's in the current proposal in Congress has much more state-friendly matching requirements, because we really want states to participate in this program, and happy to talk more with anybody offline about the details of that proposal, which I'm sure you're getting other webinar invitations and so forth. The other challenge is to protect early childhood investments at the state level from budget cuts. So not just the matching dollars, but your own state dollars. and to expand the state commitments to investing in early childhood and childcare in other ways. So what comes from the federal program, I think, if we pass this proposal, it will be really comprehensive, and that will be great. But for right now, we really need states to participate in making funding for early childhood more expansive, so that we don't have the scarcity thinking that's driving inequities. And then in addition to public investment, both at the federal and the state level, thinking about other ways of revenue raising. And I think with that, I'm going to stop. And again, you'll get some more slides that have more details on specific kind of ways of designing parts of childcare policy that have a more equitable focus. And there's a list of resources that are included. And I will share the other piece I mentioned in the chat when I'm done. So I'm not sure who I'm turning it over to. But thank you for the time. I'm really happy to be here for this conversation.
Thank you so much. We really appreciate your time and your passion. I'm struck by the fact that the pandemic has really exposed a lot of inequities that were there all along, but were exacerbated. I think about how during the pandemic, a lot of the communities that we're talking about also represented disproportionate numbers of essential workers who needed care, and childcare was already tough to come by. And especially during the pandemic, those that had to work during the pandemic were, found it extra hard to find the kind of quality care they need in the communities. And I'm sure your research moving forward will speak to a lot of that.
Yeah, it's been like a microcosm of all of the things we've experienced with the larger childcare and early education system, with a lot of urgency attached to it. So it's been really, I think a good opportunity too for states to experiment with policy changes that can make things more equitable. So there's been some good that's come out of that. Thank you.
Thank you. Thanks so much for your time. We're now going to turn our attention to what research and data is telling us regarding equity in our state. And our first panel will be moderated by at risk Kaeleigh Hernandez, the Associate Director for our Early Childhood team. And she's going to be joined by Dr. Britine Perkins of Prairie View A&M University, who has served in every aspect of public education here in Texas and in California as an advanced placement teacher and reader, academic coordinator of advanced academics, Texas State Board of Education curriculum writer, Texas State Board of Education test assessment team member, and as a public school administrator at the secondary level. She's currently an assistant professor at Prairie View A&M University, working to prepare culturally proficient teachers for our state and nation's public schools. We're also joined by Katina Thomas of Prairie View A&M University. Dr. Thomas is an assistant professor of literacy education at Prairie View A&M. Before joining the faculty there, she worked as an assistant professor of literacy education and a director of student teaching and field experiences on campuses within the University of Houston system. Also, we're joined by Dr. Kevin Thompson of the University of Houston. He's an advocate for social change and strategic social improvement in public and private systems. His social education platform and diversity, equity, and inclusion incorporation footprint can be found in numerous school districts, churches, private sector, and nonprofits throughout the country. So we're glad to have that, and I'll turn it over to Kaeleigh. Thanks so much.
Thank you so much, Sharon. And then if we want to go ahead and click to the next slide. Children at Risk has been working with the University of Houston and Prairie View A&M to look at race equity within early childhood education in Texas. And so I'm going to turn it over to our researchers who are going to share some of the preliminary findings that we found, and then we'll come back together and I will ask them a couple of questions. So Britine, Kevin, Katina, take it away.
Good morning, everyone. We're so thankful to be here and sharing this platform.
Good morning. Good morning.
Good morning, everyone. When we started looking at our research and we started looking at our preliminary findings, we also took a look at the state as a whole. And what we've noticed is that according to what was reported to the US Census Bureau in 2020, that we have approximately 28 to 29 million Texans in this state. And this is the demographic breakdown that was reported. And if you notice, we have an increasing percentage of people of color in the state. And of that Texas population, what we've also noticed is that about 2.4 million Texans are under the age of 5. And of that 2.4 million that are under the age of 5, an average of about 121,000 are enrolled in subsidized licensed child care centers and homes. And of that particular group, only about 44.3% of these licensed child care providers that are providing subsidized licensed child care are designated as what we consider to be Texas Rising Star providers, or TRS. So we started investigating to find out what is Texas Rising Star. And according to Texas Rising Star, they gave us a very detailed explanation of what it is. But what we have highlighted are the characteristics, the main characteristics of what TRS is, this program. It's a voluntary quality rating improvement system, and it's afforded to child care programs through the Texas Workforce Commission for those that do receive subsidized and provide subsidized child care. There are 3 levels of certification that a licensed child care center can earn if they elect to go through the process, and they can become rated as either a 2-star, 3-star, or 4-star center after completing the process and being evaluated. Based on their star rating, they can receive an enhanced level of reimbursement to help support the children that they receive in their centers that qualify for these subsidies and subsidized childcare, excuse me. And they also are able to receive resources and guidance. However, what we noticed was the low percentage of these child care centers that qualified to apply for this that were actually in the program to receive these resources and to receive these reimbursements. So that led us to our research questions. We have 2 research questions that we started exploring. And the first one is, why are more child care providers choosing not to participate in TRS, in this quality program, if they know that they can receive any type of financial assistance and resource assistance? The secondary question that we also were exploring is race equity a factor in their decision to forego participation?
So in order to answer those 2 questions, we decided to look at doing a survey that addressed those concerns. And so we created a survey, and then that survey was disseminated out to, in the network, Children at Risk Network, they have about 13,000 providers that are listed. And so we sent out survey links to about 6,000 of those providers, and then followed that up with mailed racial equity survey links to about 7,000 of those providers. And we did this between August 10th of 21 and ended the survey on September 30th of 21. And out of those surveys that we sent out, we received over 2,100 responses. We then followed up that survey with pulling out from those respondents from the survey and came up with 7 focus groups to follow up, to really dive into those 2 research questions, especially the equity aspect of those questions. And so we followed that up over a 2-month time period with 5 focus groups that represented child care centers in the state of Texas, and then 2 focus groups that represented family care, child care here in the state of Texas. And throughout those focus groups, we found that 68% of those were actual participants in TRS. And so again, looking at the equity aspect of that question, the focus groups, you can see there on the slide, the racial breakdown of those groups. And so that question, we were really able to address that question because as you can see, those focus groups were majority minority owners, childcare providers. And so that really helped us be able to, as we go further with this research, delve into that equity question with it. So out of these focus groups, there was a few aha moments that came out. And so some of those are noted here. One of the things that we kept hearing across the board was the paperwork concern that in order to be a part of TRS and continue in TRS, that many felt that the paperwork was sometimes quite overwhelming. However, many of those who were participating in TRS also noted that that concern was greatly alleviated if they had really good mentors from TRS. And so the need for mentors was also a major aha moment that came out of there. There was also, oh, I'm sorry, go back, thank you. So there was also this concern about, of course, the reimbursement rates. And so they felt like those reimbursement rates really needed to be increased, especially for those that were in between ratings. So as you know, at the top of the TRS system, the highest star rating you can get is a 4. And most who come in initially come in at a level of a 1 or a 2. And so they felt that in order that there needed to be more of an incentive of reimbursements to get from the 2 to a 3 to a 3 to a 4. And I am aware now that as of October 1st, they did increase those reimbursement rates. However, it is still not anywhere near where it needs to be. And so that's another thing that we need to continue to follow up on. And again, as the previous presenter mentioned, advocating with your not just state representatives, but also to fight for that package that is in Congress right now. Another thing that came out of that was the greater need for networking opportunity. We heard over and over again how they felt like a lot of times they were on their own islands and how helpful it would be to have someone else who was going through that process that they could reach out to. Many times what ended up happening with our focus groups is it turned into a networking opportunity, and they began to share with each other how to contact and advice and so forth. So that need was really highlighted. Another issue, of course, was the staffing concerns. As we know and highlighted previously, staffing is a major issue in childcare across the board, not just in early childcare, but in the K-12 system as well. But the major issue was when staffing impacts their star ratings. And so that was something they would like to see addressed as well. And then last, but certainly not least, was there was a major concern about the assessors who came in to assess their programs, which is what gave them the star ratings, and that sometimes those assessors did not possess a early childhood education background, and so may not truly fully understand the whole picture of what they were seeing in order to effectively evaluate them.
Thank you, Dr. Perkins. So we have some preliminary recommendations from our research. And going kind of piggybacking on what Dr. Perkins said regarding some aha moments, we noticed that providers are apprehensive of joining because of the paperwork involved with the enrollment. So the first recommendation is that we really want to clearly articulate the benefit of doing the work. Now, if you bought a home, if you bought a car, if you bought any major thing, you've had to do some paperwork. So we really want to make sure that the providers know that the trainings and that the resources, the certifications, and the potential opportunities that they have on the other side of that paperwork is worth it. Secondly, they are somewhat unclear as to what the full process entails. And while Texas Rising Star, in my opinion, does a great job in advertising and marketing what it is they do, We may want to take the time to ensure that there is this, what we like to term this holistic transparency, aside from just the paperwork involved and that somebody's going to come to my center, whether I know it or whether I don't know it, just to make sure that they actually know what's involved in the full process. Thirdly, they mentioned that there's a potential loss of income with enrollment into the program, given that there's a difference between the CCS and the private pay. Now, we all know that in TRS, that is a particular ratio, teacher-to-student ratio, that has to be maintained in order to keep the subsidy. So what we want to look at is developing and employing alternative methods of payment that will help us subsidize this potential loss of income, because what we don't want to do is that we don't want to increase the students, you know, per teacher. Okay, next slide. All right, providers have been very vocal about the staffing issues, even before the pandemic. So we may want to consider raising the local workforce development board's minimum annual allocations for various payment and quality childcare initiatives to allow for things such as staffing initiatives. From the last research I conducted, it seems as if that the local boards have roughly 2% of their budgets allocated to that. So we may want to look at upping that to another minimum. And lastly, but it's certainly not an exhaustive list, they mentioned that the surprise visits are stress-inducing, right? Especially when they're frazzled when handling business on a daily basis. So we want to use a more holistic approach with our visitation protocol, possibly in implementing a post-debrief session in which we kind of talk about what happened, things that were observed between the caretaker and the mentor and the assessor. And then if there were any type of infractions, offer them this optional justification procedure. So they can kind of, say, hey, this was like an anomaly. This was a one-on-one, give them a chance to rectify it and come back and, let the assessor see that, things were actually taken care of.
Thank you, Dr. Thompson, Dr. Thomas, and Dr. Perkins. And so as we, are starting to analyze this data and dig deeper into the findings, can you share a little bit about the limitations that you are starting to see? And we can go ahead and start with Dr. Thomas.
Okay, one limitation that I encountered was that a lot of data and statistics regarding the professionals that are employed in childcare is not easily accessible. We were trying to discover more exactly or more accurately how many center directors or childcare business owners were actually in the state according to demographics, but it was very hard to find, to access, and we know that what was discovered was voluntary. So we were having difficulty trying to determine exactly how many, according to racial, ethnic background, gender, and age, was discovered as far as center owners, center directors, because there's not anything that we can just readily access so that we would know, so that we could have a more accurate investigation, further investigate, and be able to get to more of the center directors and center owners of color.
Thank you. And Dr. Perkins, what are some limitations that you're seeing?
Some of the limitations obviously are with the major staffing issues that they have. And so in order to be able to access them for the focus groups and to get them to respond to surveys is a challenge, because they simply do not have the time for their voices to be heard right now.
Yes, we're seeing staffing as a consistent issue across the country. Dr. Thompson, what are some limitations that you're seeing?
I think a few of the, well, one in particular is within the aha moment is that they really are not, or they really don't have an opportunity to kind of network and talk about these issues. They feel as if they're in silos, right? And as the previous presenter stated, we have some childcare deserts, right? So, and while these people, some may have a great mentor, some may have a not so great mentor. So the experiences are, are varying. So you're getting different pockets of information. It just really depends on who you talk to and where you talk to them, you know, their geographical location. So it's kind of hard to really put your finger on exactly what it is because the experiences are varying. And by, you know, it being so broad, you know, with so many people, it's kind of hard to pinpoint what is what, because they have varying experiences, because they have varying experiences with different level of mentorship, different experiences with actually applying for the program and through implementing it. So it's kind of touchy there.
Thank you so much. And I know we are almost up on time, but I do want to ask you one more question. As we're starting to continue to dive into this racial equity work in Texas, can you guys talk a little bit about what are some things that we want to continue to explore?
I think we want to continue to explore the equity side of things. You know, just going back to the stats that Dr. Thomas presented earlier, and also with the previous presenter talking about, you know, the child care center deserts, we really need to look at that particular disparity and ask why, right? You know, okay, why are they apprehensive to applying, you know, to the program? Is it because of the paperwork? Is it because of the level of education? Is it because they're simply tired and stressed out and really can't take on another task or another certification, so on and so forth? So I think we need to press forward there.
I would have to agree with that. The race equity side, or the race equity aspect is something that we want to explore more of. And we think that as we start continuing and digging deeper, we're hoping that we can find out more information regarding that and more accurate feedback and statistics along with qualitative investigation to be able to determine exactly where distinct discrepancies are, so we can have something a little more concrete.
Yes, and we also discussed looking at ways to explore more on suggestions for impacting to get policy change to where we could increase the pay for child care providers, especially those teachers that are in those classrooms with those children, because as we know, that is really impacting the education for our early childhood area. And that's the lack of staff. And one of the major reasons we're seeing for the lack of staff, obviously, is the lack of pay. And so we would really like to explore what are the ways can we come up to subsidize, raise pay. I do know, again, we have the package there in Congress, but as the other presenter mentioned, we really need to be advocating on that end, but that's at the federal level. What can we do at the state level to increase pay it all for those teachers who are actually in those centers? Because we know that's going to make the biggest impact. If we can keep the staff in those centers, that's what's really going to help us with the education of our children.
And lastly, one thing we noticed was there was a lot of autonomy across Texas workforce commissions in the state. So when we had the opportunity to talk to the members of the focus groups, the center directors and owners, some of them could not tell you who their local workforce was. Those that could, they all mentioned the different ways that each one operated. So if we can have some type of continuity and some consistency, that might be able to be some assistance as well. So to try to investigate that as well.
Well, thank you all so much for being here. I know we are looking forward to continue working with you as we dive deeper into this work, and then we will be releasing a report on our findings in the spring of 2022. And so Sharon, I will go ahead and hand it back to you.
Thank you so much, Kaeleigh. Doctors Thompson, Thomas, and Perkins, we really appreciate this great collaborative work. And we're able to see a full picture of the hesitancies of providers to participate in the Rising Star program. And I am certain that this research will help both providers and those who are administrating the program to find their way to each other and to ensure that these resources are delivered and children have greater access to quality care. So thank you so much. We look forward to that full report. We're now going to take a deeper dive into an area that comes as no surprise. We can't talk about early childhood inequities without talking about early childhood workforce. So if you'd ask our next set of panelists what their #1 concern for the early childhood industry was prior to the pandemic, it probably would have been general concerns for the early childhood education workforce. The COVID pandemic has brought to light many of our biggest concerns, and the workforce is making poverty level wages. Parents can't afford to pay anymore, and the workforce, of course, is being vacated. People are leaving, which leads to classroom closures, or worse yet, childcare program closures. So our next set of speakers will be sharing their knowledge and wisdom regarding these issues and more around the early childhood workforce. This panel will be moderated by our own Makia Thomas, Children at Risk Assistant Director to Early Childhood Education. And she will be joined by Anna De Hoyos O'Connor, who's Professor of Early Childhood Studies at San Antonio College. And her experience includes working with early intervention programs, Head Start, childcare, and after-school programs. She's worked with young children from birth to age 8 as a classroom lead teacher and as a demonstration teacher. Cody Somerville will join us. He's the Executive Director of Texas Association for the Education of Young Children, a professional membership association that works to advance early childhood education and the early childhood workforce across Texas. He began his career as a kindergarten teacher and has served in a variety of roles within the early childhood programs, state government, and educational technology, each providing a unique opportunity to support the quality of early childhood education. And Patsy Harnage, Bright Beginnings Childhood Development Center. She's got more than 15 years experience as an owner, director of Bright Beginnings in Austin. She's earned dual bachelor degrees in early childhood education and nonprofit management from St. Edward's University. And she also holds a certificate in nonprofit management as well. I'll turn this over now to Makia. And as a former pre-K teacher myself, I can't wait to hear this panel. So thanks so much.
Awesome, awesome. Thank you so much, Sharon. I'm so excited as well to kind of get into this discussion with you all. You guys are such powerful advocates for the workforce. So I'm just going to jump right in. And this question is for all panelists. How are you in your current role addressing barriers to ensure we have a diverse, well-qualified workforce? And we'll start with you, Cody.
Thanks, Makia. So here at Texas EYC, we are working to advance that well-prepared and well-compensated workforce through our Teach Early Childhood Texas program, which provides scholarships, and not just kind of your traditional scholarships, but true comprehensive scholarships to early childhood professionals to obtain their CDA, associate, or bachelor's degree. And we also work with state agencies and policymakers to ensure that policies are crafted to meet the needs of a diverse and effective early childhood workforce.
Great, thank you for that. Anna, you want to jump in?
Sure. Hi, everyone. So I'm a professor at the Alamo Colleges, San Antonio College. And one of the things we do is we collaborate with our community here in San Antonio. And what we like to tell our community is we listen. So we're involved in many of the programs that are happening here in the city. We attend meetings. And we also have a diverse group of leaders that are part of our advisory board. And that way we are listening to what students need. We've listened, and so we've completely changed our menu. And so we used to teach, face-to-face classes in the morning and night. Now we teach online, blended, 8-week, hybrid. Our Saturday class did not make, but we're going to bring it back again. And so we listen to students to find out where are they at and what do they need. We also are moving forward in open education resources, OER, so that we help students recognize, right, that there's so much information out there and we decrease the cost of books. We connect to the community. We're really close with our programs like Teach and our Texas Workforce. And we spend time with our students advising them, providing them information about their pathways and really coaching them about how this is their pathway and engaging with them on how to, come to school and how to balance school. We bring in speakers to talk to students so that students can have conversations with their families. So we connect with the community. More than anything, we connect with our parents, and many of them are parents, our students. We also offer classes that denote that an instructor is bilingual. So I am bilingual, so students know that they can come to me if I need to translate something. And we reach out to other programs in our college if I don't know the language. So like last year, I don't know Farsi. And so I had a student who would say, I think I understand it, but can you help me? And we did a Zoom with someone who was taking the information and then giving it to her in her language. So we really are trying our best to meet the needs of our students where they're at, collaborate with them, collaborate with our community, and really go beyond what we've done before.
Wow, there's definitely a great level of investment as far as that partnership with the community of learners, the students, and also just the community that the students will be serving as well. That's great. Patsy, you want to jump in?
Yes, thank you, Makia. My name is Patsy Harnage. I'm the owner of Bright Beginnings Child Care Center in Northwest Austin. And at Bright Beginnings, we treat our employees like humans instead of commodities. Bright Beginnings have always known the importance of acknowledging and supporting our employees' human needs, whereas in their families, their finances, and their mental states. At Bright Beginnings, we have many benefits that support childcare through our local workforce board. And we also offer free childcare for our teachers, because that's very important, because with their low salaries, they're not able to afford childcare. So at Bright Beginnings, we give them that benefit. We also have higher education opportunities for our teachers to obtain their degrees in early childhood development through programs like Teach. And also we support their mental health through programs like the Austin Child Guidance, so that's very important in dealing with early child care. We also offer upper mobility within our company. Our teachers are able to become lead teachers and later obtain their teaching certifications, also through the Teach program. And with the pandemic, we were able to offer our teachers higher salaries. And we wish this could sustain even more, because it made a big difference in our productivity within our company. Teachers were able to feed their families and take care of their children, which is very important. The pandemic has pushed employers to see workers as humans instead of commodities that could be replaced easily and swapped out. This has given workers greater bargaining power that they didn't have pre-pandemic, especially women, who has always gotten the short end of the stick. This shift could be here to stay. Greater emphasis on the importance of diversity in the workplace is being pushed by consumers and the government.
Thank you, Patsy. I appreciate you pointing out, really looking at how much that the pandemic has exposed all the inequities that have always existed. And really, we heard from Christine earlier that really the foundation of our system really has been built on the backs of people of color, and primarily women of color. So I appreciate those words as well. The next question I have is for you, Anna. How do you make sure the workforce you're preparing has the skills they need to create racially equitable experiences for children and families?
So one of the things that we've learned to do is really build a community of learners. And our program, not only our center, our lab school, but our program is nationally accredited. So we always are reviewing our assignments, reviewing what we do, and link not only equity, but anti-bias in all of our classes. It's got to be something that is weaved into what we do. We also work with our students and provide a student organization, not only in the morning, but at night and on weekends, so that we can involve students to be part of learning. Here's an example. Just tonight, students are going to be invited by the LGBTQ organization to go and be part of Lucas, the movie, and have a discussion on what this means and be part of this discussion about gender equity. And so we work in our program to start where they're at, understand that they also need coaching from their directors and owners. So we, before the pandemic, involved directors to come to our program so that we could learn together. And I think more than anything is as faculty setting examples. I was at the TAYC conference and I was at a session and a director came up to me and she said, "You're attending?" And I said, "Absolutely." And so I think attending sessions, reaching out for help, being part of this, not only presenting, but I'm also listening and learning, taking notes is really key. And so embedding it, taking them where they're at and understanding that it's not going to be the depth and breadth that they might get when they work on their BA, but what they're learning is a strength-based approach to working with children and families. And what they're learning is that we all learn together, we cry together, and we provide links to all current trends. So when we learn something new, we all bring it to our classrooms, we share information and model that it's a process and what we do. We also focus on where we're placing our students. And there was a time where we were only focusing on accredited centers. And I'm glad with the help of becoming accredited that we think differently. Our lenses were different, but we were stuck in old school, as I would say. And so now we're placing students across the board in Texas Rising Star homes, centers. We're placing them at our shelters right now for children so that they can see what's happening in our community. So students are provided opportunities to learn, to grow, explore, and to challenge themselves. The key is that community of learners and slow steps and consistency, really just adding it, talking about it. And because we're a very small program, there's only 3 full-time faculty members, I can come in and say, remember in this class, this is what you did. So let's talk about that. And how does it weave in? And that helps with the learning process of our students. I can go on.
Yeah, I love it. I love it. That idea of a community of learners is great. Definitely that. I love how you have the students go into different settings and not just sticking with the traditional setting, because that exposes them to, family childcare. And sometimes I think that would have been left out of the conversation. So definitely, and then setting that example, having conversations around race equity, anti-bias, anti-racist curriculum, that's difficult for a lot of people. So just being open-minded and modeling, hey, I'm still learning, this is a learning process. That's great.
We also work really close with our local chapter and our TAYC, and when possible, take students to the conferences so that they're able to see that there's more to them, and they're able to witness how many amazing teachers there are and leaders there are. And then we do different campaigns. We are in downtown San Antonio, close by, and so we do have a large homeless population, and we rally the students together and we collected socks and jackets and different items, packed them really nice, put some nice notes in there, and then worked with other organizations to pass these out. So again, it was warm. To me, it warms my heart when a student says to me, I was biased. I had a bias towards homeless. This is what I was told by my parents. This is how I reacted. And hearing their stories and hearing that they don't have families, or hearing that they, lost everything because of a job and didn't have a resource, I could be there. And so to hear those testimonies for students, those hands-on activities that we do helps them. Like tonight, they're going to be meeting other people across campus, and it's new to them and they're afraid. But we've got to be there together to learn and grow together. And that's what's going to help. That's going to change your lenses. It's going to take them off, clean them, put them back on after we do a good cry sometimes.
Great, great. Cody, this next question is for you. How are you making sure all communities throughout Texas and within our workforce are being reached when trying to get them back into school?
So key to helping early childhood professionals go back to school is just recognizing all of the barriers and challenges that come with obtaining credentials and degrees, and really building a comprehensive program that addresses those challenges and minimizes many of those barriers. So with our Teach Early Childhood Texas program, we provide comprehensive supports for individuals to obtain their credential or their degrees. We, for our associate and bachelor degree scholarship recipients, we recognize it costs money to drive your car to go to class. So we give you a travel stipend. We also recognize that in the 21st century, technology is needed in order to be successful in higher ed. And so we're able to reimburse for technology costs so you can buy a laptop so you can attend those, hybrid or virtual classes. We also recognize that with higher levels of education should come higher levels of compensation. And so our scholarship program builds in bonuses for completing coursework, completing degrees, and there is also met with a commitment from employers to either give a bonus or a 2% raise. We also recognize, there's not just kind of these financial barriers, but higher ed is a difficult landscape to navigate if you are a first-time college student in your family, or you have limited experience navigating higher ed. And so all of our scholarship recipients are paired with a teach program specialist who is their cheerleader, who checks in with them every single month just to see how things are going. They build a relationship, and so they know what courses you're enrolled in. And all of our teach specialists have been classroom teachers before, so they also recognize the challenges that our scholarship recipients are facing, not just in their education, but in the classroom. And so they're able to kind of be that mentor, that coach, that cheerleader, and help them just navigate the systems and the supports and resources that are available to higher education students. And many of you probably heard on Tuesday, the Workforce Commission approved a $7 million increase to teach funds as we think about best use of those funds and how to make sure that we're using those funds to eliminate even more barriers. We're going to be evaluating all of our scholarship models and making some adjustments starting here in the spring, where we will increase bonuses, we will increase release time reimbursements, and really think about not just serving more people, but ensuring that all communities have access to this program through building in more supports and resources as part of our scholarship program, so that obtaining that credential or degree is more possible and more feasible for all communities.
Thank you, Cody, for that. All those great embedded resources and supports is going to be amazing. Patsy, this one's for you. And I know we're short on time, so I'm going to try to fuse the last one. You shared a lot, although previously when you were sharing how you have attracted and retained a lot of the workforce that you have, or sustained them rather throughout the pandemic. Could you kind of tell us a little bit more about how you retain and advance them, and just dig a little deeper into that for us at Bright Beginnings?
How I retain my staff members is through programs like programs of actually the job workforce, the temp agencies. Our employees come over from the temp agencies, and they're already trained, and they already have some knowledge of early childhood and experience. And then after they work with me for about 2 or 3 months, and they meet high quality standards, I send them on to further their education, whether it's a CDA or through Teach, do a CDA or AA degrees in early childhood. And I'm also a Teach. I was also a Teach graduate as well. I obtained my BA degree through Teach because I wanted my business to be sustainable, and I wanted to go back to school and get my early childhood degree, and also my early management degree as well. And the teachers, it's very important for teachers to have the foundation of early childhood so they can deliver high quality. And from there, they are able to, after they get their BAs, they are able to get their teacher certifications. We are a United Way Center, and we're partnered with AISD for our 3 and our 4-year program. So there's upward mobility where our lead teachers can become certified teachers and teach at the school district level.
So definitely lots of opportunity for growth, and definitely you have a lot of just things embedded within your program for your teachers, which is great. And Patsy's actually featured in our ECE newsletter that was released in September. So if you're able to check that out. So just some closing thoughts along the same vein for Anna and Cody to kind of close us out. How can we ensure, again, the early care and education system is ready to retain and advance the diverse workforce that we have? And I'll start with Cody. Go ahead.
So I think, there's a few things the system can do, and that's continue to build the supports for the workforce, recognizing that the workforce is executing a high-skilled job, and high compensation should be met with high-skilled labor. And so building up both the career pathways and the supports to obtain those levels of higher levels of education, and pairing that with higher levels of compensation. So that way, when a teacher obtains their degree, staying in the classroom is an economically viable option for them and their families.
Thank you. And Anna, closing thoughts around that?
Well, I think coming back to what the morning presenters talked about, let's bring teachers to the table. And that might mean that we rethink when we're meeting, and we rethink who's at the table. And not just one time, but really including owners and teachers at the table, and hearing from them and listening to them. And I think also collaborating, really coming together, and passing the baton, saying, we don't do that, have you call them, picking up the phone and saying, you do this, why don't we collaborate together? I really appreciated how Patsy, she sets the stage right there for her staff, saying, I want to keep you here. And so let's see how we can collaborate so that you are going to get paid what school district teachers are getting. Maybe I have a classroom with the ISD. And so I think all of us as advocates, when we're out in the community, is listening and collaborating and telling people, let's not be afraid to collaborate. You're not going to lose something. We're going to gain when we empower our teachers. They will then turn around and do some amazing stuff with children. And so it's really holding ourselves accountable to work with them and want more for our teachers. Right now, I tell my students all the time, you hold the golden key because you're needed. And so go and find out where you want to go, make sure they take care of you. And students are starting to feel empowered. I think teachers are starting to feel empowered, and they know they do have the golden key. And they're the brain developers that we need. So collaboration and focus on bringing them to the table and keeping them at the table, not just one time.
Thank you all for such great nuggets of wisdom that you've given us, and just also things to think about on how we could advance our advocacy and our work. So I appreciate you for y'all's time, and I'm going to pass it back to Sharon so we can just stay on track. Thank you again.
Thank you so much, Makia. And thank you, everyone. What a wonderful conversation. It's so inspiring to hear from a provider who's not only providing great care and education to families and children, but supporting those who are educating those children. And it's great to hear from colleges and universities who are meeting students where they are and supporting them to go back to school, not just to continue that education, but to better themselves and their families. And that's what a community is all about. So we appreciate that. We're going to take a 5-minute stretch break, so don't go too far, but please come back in 5 minutes. As everyone made it back from the break, I hope you had the opportunity to participate earlier this morning. And if not, you missed a great informational and inspirational group of panelists and presenters. Now that we've focused on the workforce, we're going to take a look now at how children and families are accessing high quality early education in their communities. We know that there are childcare deserts across Texas, and they've increased since the beginning of the pandemic, especially in communities of color. This next group of experts will lead us through this discussion. We're very honored that Dr. Jen Neitzel will be moderating. She's the Executive Director of the Educational Equity Institute, focused on eliminating the educational and opportunity gaps within communities through system level change. Prior to this work, she was a research scientist and technical assistance provider at Frank Porter Graham Child Development Institute at the University of North Carolina in Chapel Hill for 15 years. During her time there, her work focused on implicit bias, disparities in suspensions and expulsions, trauma, and culturally responsive anti-bias practices. We're also going to be joined by Dr. Teresa Granillo with Avance. She's the Chief Executive Officer there. She previously served as Executive Director of Con Mi Madre, a two-generation organization that supports young Latinas on the path to higher education and engages their mothers in the educational journey alongside them. Additionally, we are joined by Dr. Tanya K. Durden with Georgia State University. She is a clinical associate professor and birth through 5 program coordinator within the Department of Early Childhood and Elementary Education at Georgia State. Dr. Durden's primary scholarship and research trajectory focuses on exploring how to develop and support African-American children's social, cultural development and create racially equitable learning experiences for children of color. We're also joined by Pablo F. Calderon with Early Learning Alliance. He's on the Early Learning Alliance leadership team in Tarrant County and co-chair of its Racial Equity Guidance Council. He received his Bachelor of Science in Secondary Education from the University of Texas at El Paso and Masters of Public Administration from the Kennedy School of Government at Harvard and Master of Theology from Perkins School of Theology, SMU. Also pleased to introduce to you Dr. Choquette Hamilton with Rise Child Development Center, Incorporated. She's founder and CEO at Rise, which is an anti-racist organization created to dismantle inequity in early childhood education. In addition, she's the co-founder of Real Solutions Consulting and Coaching. Real Solutions is a firm committed to increasing an organization and individuals' capacity to foster restoration, equity, anti-racism, and liberation through training, coaching, and strategic planning. All right, I'll turn this over now to the panel. Thank you for joining us.
Thank you so much, Sharon. Hi. Like Sharon said, I'm Jen Neitzel. I'm the Executive Director of the Educational Equity Institute. I'm happy to be here today to moderate this fantastic panel. I am so excited for this really robust conversation about what equity looks like in early childhood. So I'm going to start off asking a question to everybody about is equity in early childhood. So what does equity look like in early childhood education? And I'm going to start off with Tanya.
Hello, and thank you again for having me. Well, when I think about equity, so a part of my work is I work with teachers, both that are practicing teachers and those who want to join our wonderful profession, as well as leaders and researchers and et cetera. And so when I think about equity, right, I think about equity in relations to children, and how equity is that all children have the access to experiences that are joyful, that create safe spaces for them where they can bring their authentic selves, meaning their languages, their multiple literacies, their culture, their ways of being into the classroom. And so when I think about equity, I think about it very much so from the lens that all children have access to experiences that are culturally relevant, that are anti-racist, that are anti-biased, and that really allows them to be the brilliant beings that we know that they're capable of being. And so I look at it on that level of equity, because many of our Black and Brown children do not have access to safe, joyful, and loving classrooms.
Great, thank you so much, Tanya. What about you, Pablo? What does equity look like in early childhood for you?
Seeing children enrolled in programs being provided by agencies who've conducted self-assessments with an equity focus and who have developed equitable policies, budgets, and programs. They provide racial equity training to all staff. They gather disaggregated data of key indicators of the populations that are served. They design and implement programs with stakeholder input, communities, families, and also the providers. And finally, they communicate those services in culturally appropriate ways.
Great, thank you so much. Teresa, what about you? What does equity in early childhood look like for you?
Well, it's really hard to add anything to what Pablo and Tanya have shared, because I wholeheartedly agree with their approaches. I would say the only thing that I would add, because at Avance, we center all of our work on equity, and I think we all share that, right? And to us, part of that means that our educators, our teachers reflect the population, the children, and the parents being served. And so that proximate leadership is so critical to equity in early childhood, recognizing that many of our children, particularly in Texas, are Black and Brown children, and that our educator pipeline is not reflecting that. And so we really work hard to make sure that our teachers reflect the communities being served, as those who are from the community are best suited to serve that community. And so that would be my only addition to what I look at in terms of equitable early childhood education.
Okay, great. That is a very important addition that I think needed to be said. What about you, Shoket, right? I want to make sure I get your name right.
That's
Shoket.
right. Yes,
okay.
Thank you.
What do you have to add about equity in early childhood?
Yes, I do want to echo what the other panelists said. Certainly the experience of the children in the classroom being culturally responsive and an anti-racist liberatory education, as well as the experience of the teachers. What I would add to that is the access for children and their families to high quality care in environments that are not segregated. And so what we see is that a parent's ability to pay often dictates what access to high quality care they have. And so what can be done about that? So some of the things that we're doing and thinking about at RISE is using income-based tuition models, so that no matter your income, and let's be clear, this is not just a low income family problem. Middle income families cannot afford childcare, and we cannot continue to ask our parents to bear the cost and burden of care. And so the cost of care and making sure all families have access to the same quality care in the same spaces, so that we're not creating segregated environments and replicating that inequities from the start, is another way that we center equity, and I think how we should be centering equity in childcare overall.
Fantastic, thank you for that. And I think that it was the last panel or one of the that said that how COVID has really shown a light on the inequities within childcare, and you can really see the childcare system crumbling under the weight of decades of not valuing early childhood, particularly childcare. So thank you for that, Shoket. All right, Teresa. So I want to turn our attention to the pandemic a little bit. So how has the pandemic changed how families are choosing childcare? Have preferences changed? And then a follow-up question to that, is there enough high quality capacity to meet those demands?
Great question. So first, because we are having a conversation about equity, I just want to mention that even in the question where we mentioned how has it changed parents' choices, some families don't have a choice, right? Choquette just mentioned that when it comes to childcare. So if you're a single working parent like my mom was, without a vehicle, you need to find a childcare option on your bus route to work or somewhere in your neighborhood, right, where you can walk to drop off and pick up your child. And so there are a lot of factors that influence the type of childcare that families are using rather than choosing necessarily. So I'll say that. And then in terms of, how has the pandemic shifted preferences for the Latinx community? Family childcare, and that's a focus at Avance. We really do work with home-based childcare providers, family-based childcare providers, and for our community, Latinx families are 22 times more likely to use this family home-based childcare compared to non-Latinx families. Part of this is because they like the small ratios in the family-based care with only 12 children per home, where their child will get more concentrated attention and care, and it feels more familial. The other influencing factor is that many Latinx working parents are in the service sector and they work early mornings or late evenings. And so home-based childcare providers often have more flexible hours that can accommodate those types of work schedules. And finally, as in my example above, sometimes they use home-based childcare because that is the only provider nearby, particularly with our families living in rural communities. So when you hear that and you think about the pandemic, we've actually seen a stronger preference for home-based childcare in non-Latinx communities for the very same reasons listed above, right? Smaller ratios, so less chance of COVID transmission, and then these more flexible hours to support some of our essential workers. So we have seen some shift, but it's not necessarily for the communities that have been using home-based childcare to begin with, but it's in other communities getting more exposure and realizing that home-based childcare is an option. Now, you had a second question, which is about, okay, is there high quality options and is the demand bigger than the supply? And obviously we've all seen all the data around the childcare deserts, and so we know that the demand is higher than the supply, and so I do want to make a comment about, like, when you say high quality, right, is there enough high quality capacity to meet these demands? It depends on how you define high quality. If you look at the number of home-based childcare in the Texas Rising Star system, in some areas like Laredo, Texas, there are literally zero home-based options that are listed as Texas Rising Star. But even in places like San Antonio, there are only 4 listed and registered homes in the TRS system. So if you're looking at it from that lens, like, we are in a very, very dire place. But I do want to say that just because a home-based provider is not in the TRS system doesn't mean that they are not high quality. In the work that Avance does with home-based childcare providers, we have seen some providers that provide high quality care. I think this was mentioned earlier. They just don't either know how to navigate the system to get TRS, or they don't want to because they're afraid of the system. And so we actually have a program called the Quality Childcare Matters program, where we support home-based childcare providers to increase the quality of care in their homes through a curriculum-based course. And we work with informal providers as well as licensed and registered providers with the ultimate goal of not only increasing quality and getting providers in the TRS system, but also to increase the supply of quality home-based childcare providers to meet the growing demand for home-based childcare and ultimately address our childcare crisis in a way that honors parent choice.
Great, thank you for that really helpful and illuminating information about the home-based childcares in Texas. That's pretty remarkable. All right, so Tanya, I want to turn my attention to you now and talk about your fantastic book, Don't Look Away, Embracing Anti-Bias Classrooms, which if you don't have it, get a copy because it's awesome. All right, so you recently co-authored this book. Could you tell us a little bit more about how we can ensure access to racially equitable, high-quality educational experiences for the children and families that we serve?
Absolutely. So I'm going to provide just a little bit of information. Of course, you can read the book, because Don't Look Away, Embracing Anti-Bias Classrooms, as you just mentioned. And it's a very step-by-step practical guide. It is meant for the direct care provider, for the instructional leader, for the director, the principal, whoever works directly with children and families. And so it provides a really great context, first of all, of why we even need anti-bias, anti-racist, culturally relevant education in early childhood. So it first breaks down, all of the things we know about institutional racism, about the disproportionate number of Black and brown children who are tracked into special education services, how our biases, our prejudices really does impact the quality of education that we provide to young children. So it provides that background, but then it also provides very explicit ways in which we can create racially and culturally equitable spaces for young children. And so a big part of what we talk about is what I kind of chunk into 3 different areas. So your belief systems, your whole ideology about teaching and learning, and about particularly Black and brown children, and then the practice as well as the policy. So when we think about the belief system, a part of anti-racist, anti-bias culture, whatever the term you're going to use, is really having a belief, a true belief that all children are capable, that they are brilliant, that are geniuses, and that it is our honor and our privilege to be able to teach them and to be able to draw out the rich linguistic and cultural knowledge that they already bring. And so that's first. You have to first have the belief that children are capable and that they are brilliant, and they already come with us, come to us with all of this knowledge and this information. And our goal is just to pull it out instead of banking information in that we're all knowers. We're pulling it out, and we're starting first with their own reality, their experiences, their curiosity, their languages, their culture. We're beginning everything with what children already know and they bring. So that's the first piece, is the belief system. The second piece is the actual practice, right? So the practice is, how do we actually engage with children from culturally and linguistically diverse backgrounds? And so we have 3 different frameworks that we talk about. So we have culturally relevant, which is, again, beginning everything with children and their reality and their experiences. So I can't talk about community helpers unless I know what community helpers they're actually experiencing in their community, not in this random community that's in this curriculum book or this curriculum guide, but what are the community helpers that are in the community in which the children live? And what are those community helpers that should be in the community that's not in the community? And then, so that gets into anti-bias, because there are some, quote, community helpers that in some cases, in some communities, really aren't community helpers and may have a really negative type of relationship with members in the community. And so again, all learning, all experiences starts with children's their knowledge and their ways of being. Also, culturally relevancy is really looking at kind of like the senses, right? So children should be able to see themselves, like literally see themselves, pictures of themselves, pictures of their families, pictures of people who look like them. They should also hear, have familiar things that they hear. So they speak multiple languages. They should hear during transition, time, instrumental music of, music that they may hear at home, or actually hear the languages that they hear at home in the classroom as well. They should also have an experience where their natural ways of being, right, is valued in the classroom. So for example, our early childhood classrooms, from all of the, assessments that are pretty popular, like the Itters and the Eckers in the class, really they'll focus a lot on individualistic type of culture, which is fine, but it excludes a whole population of Black and brown children. And so when we think about Indigenous populations, when we think about Black families and Latina Latinx families, many of our cultures are collectivist culture. And so it focuses more on group dynamics. It focuses more on cooperative learning. And so we have to make sure that we are having experiences that allow children the opportunity to demonstrate in multiple ways their knowledge and their ways of being and their understanding. Even when we think about infant and toddler classrooms, particularly infant classrooms, and we think about some of the regulations that we have and some of the policies related to sleeping, co-sleeping and shared sleeping is a huge cultural practice in many ethnically diverse backgrounds. And so when we expect even our little babies to sleep on their own in their own, little area, that is not culturally connected, and that is not responsive to children who come from diverse backgrounds. So really looking at the practice and making sure that we are elevating and including the voices, the experiences, the cultural practices of the children we serve. So that's the culturally relevant piece. The anti-bias piece is really addressing our own biases and how we are really perpetuating the isms that we see in society. So how we are perpetuating sexism, racism, xenophobia in the classroom, and how we're not helping children to recognize unfairness and also helping children to recognize ways in which we can be equitable. So that's anti-bias. And of course, anti-racism is just a fragment of anti-bias where it's saying, okay, we know that there are individuals in our society who are treated unfairly and discriminated against because of their color. We also know in early childhood that we have disproportionately, children who are expelled, who are suspended, who are tracked in special education, who are engaged in very, violent, spiritually violent experience in the classroom because of the color of their skin, right? And so that is really the crux of anti-racist experiences, where we go to the level of looking at the quality of our educational experiences, and we actually look at it from a racial perspective. Who are the children, both race and gender, that we are expelling from our programs, that we are tracking into gifted, that we're tracking into special education? And really looking at it from that very granular racial level, and then creating opportunities that actually support positive racial identity. And lastly, we're looking at the policies. So we go back through and we say, okay, what policies are inclusive of creating racially equitable, culturally relevant experiences? Do we have policies that's only focused on individualistic culture and ways of being? Do we have policies in which we're really not recruiting or retaining an ethnically and linguistically diverse workforce? So what are our policies that are really impacting how we are creating accessible and equitable learning experiences? What are our assessments, right? So are we only assessing in one language? That is a policy that is already setting up this mechanism for children not having multiple ways of demonstrating their knowledge, their home language, and their home experiences. Because what we know from culturally relevancy is children already have this information. We're just not assessing them in a manner that really allows us to identify how they are demonstrating this knowledge that we are planning to assess. So want to learn more, definitely read the book. It provides a lot of activities and experiences and scenarios of how to actually implement this work.
Great, thank you, Tanya. And what I love about your book is that basically because you're just basically speaking truth right now, and your book is just straight up truth. And it's like, it's so good at laying out the why, the what, and the how. And it does a really great job of deconstructing whiteness and anti-Blackness within early childhood. So thank you for all of that. All right, so we're getting low on time, but we're going to get to Choquette and Pablo. So Choquette, you're next. All right. So you recently opened the RISE Child Development Center in Austin, Texas. And what inspired you as a parent and an educator to open a center with an anti-racist curriculum?
Thank you. So everything that Dr. Durden was talking about is what I am trying to create here at RISE. And this has come out of my own personal experience as a parent. I was, full-time. I was working full-time. I was also going to school part-time. And as Dr. Granillo said, I didn't have lots of choice. I had no choice but to find care outside of my home. And I found quickly that I did live in a childcare desert. And, you know, what I know now, what I didn't know is that because living in a predominantly Black and Brown community, I did not have access to high quality care. And so when I did find care, I had to commute an hour each way to get there. Could barely afford it, even with a middle income, 2-income household. And all of these inequities in my experience just started stacking up. And by the time my second son went off to kindergarten, we had went through 5 different center-based we went through 5 different centers. And through that experience, we firsthand experienced the anti-Blackness that even our precious babies experience. And I'm the type of person who is like, I will only complain for so long before I decide, okay, you're either going to complain or you're going to do something about it. And I come from an education background, and I just saw the amount of resources that we put into children showing up not kinder ready, and just the incredible missed opportunity around early childhood education, these critical years. And so I kept dreaming about what I would do differently. And that's how RISE was born. I want to create an anti-racist and liberatory early childhood education that is not only accessible and fills seats right now in Central Texas, because we are a childcare desert, but then also is a model that is able to be replicated and scaled so that all children have access to high quality care that is anti-racist and liberatory early childhood education. So that is why I started RISE.
Great, thank you. That's a really wonderful story. And so those children are so lucky to be in your care.
Thank you.
All right, so last but not least, Pablo, the Early Learning Alliance is addressing racial equity. And what does equitable early childhood education look like for children 0 to 5 in Tarrant County?
Recognizing that it takes a full village to raise our children, we're a broad-based collaboration. Government officials, ISDs, nonprofit providers, early child care providers, health and mental health professionals, workforce solutions, foundations. And that's a key part because they have a good sense of what's being funded and where the holes are, and the city of Fort Worth. Building a foundation to have strong and informed equitable practices requires a lot of steps. It's a long journey. I'm just going to mention a couple of the key steps we took. Back around 2015, 2016, we invited the National League of Cities, equity-based training, to come and do a broad introductory session on equity to our leadership team and to our members. A year later, we followed up with a 2-day training by the National League of Cities. We decided at some point around 2016-17 that we actually needed a task force within the Early Learning Alliance, ELA, to look at racial equity. And one of the first things that we did was to do some research and see what kinds of resources were out there that not wanting to recreate any new instruments, but we designed a program using 6 steps that we then shared with our member organizations. And each of the steps had sub-steps, all equity focused. And it was, you select outcomes, you collect and analyze data, you design the program to address the outcomes that you've selected, always with stakeholder input. And stakeholders begin with the families, the recipients of the services, and the providers and the community that we're serving. Then you need to evaluate and monitor the programs that you have implemented. About a year later, we recognized that many of our providers, particularly in small and mid-sized agencies, did not have ready access to the resources that are would be applicable to each of those steps. So we developed a toolkit that provides resources, beginning with what's the Early Learning Alliance priority areas, what are early learning outcomes, organizational self-assessment examples, statements of benefits and principles that are equity-based for planning processes, for designing programs that improve children's well-being in an equitable fashion. Then going a step further, how do you assist our agencies and providers in implementing equitable programs? We hired a consultant to do 2 days of training each for 17 organizations, their staff, to understand equity, racism, bias, what are the programs, practices that they have that may be furthering or worsening the bias and racism. And we did that for 17 organizations. 2 years later, we hired a second consultant to go through a somewhat similar process, this time for 8 organizations, examining bias and racism. We understand that it's a responsibility of everybody to weave in or infuse into all their work equity. It's a responsibility of everybody. We have a Racial Equity Guidance Council, and we are assisting our ELA committees in the work they're doing in professional development, in getting more 3- and 4-star TRS centers. We're working with our Providers Council and with our Parents Council. Lots of steps in this journey.
Great, thank you so much. And my deep apologies for going over time, but there was such great conversation and I didn't want to cut anybody off. So I apologize, Sharon, and I'll turn it back over to you. And I just want to say thank you for being on this panel today. It was great to be in your presence and lots of great information.
Thank you, Jen. It's understandable. This is such a riveting conversation. I appreciate your moderation. I'm struck by Tanya's commitment to providing safe, joyful, and loving classrooms for all children. That resonates with me. I appreciate that Pablo and Teresa are out there providing educators and caregivers the tools that they need to do this work. And I'm so appreciative that Choquette is actually in the trenches getting it done. So what a great panel. Thank you so much. Thank you, all of you. We've heard about the challenges facing us as well as some examples of solutions, but we know that these issues don't exist in a bubble. As a community, we're all tied to each other to support each other and to develop programs and public policy for each other. Our next panelists will take a look at what's happening at both the federal and state level and what are possible next steps for us here in Texas. So our own Kim Kofron will be moderating this section of our agenda, joined by Lauren Hogan and Mandy Kimball. Kim is the Director of Early Childhood for Children at Risk. She previously served as Executive Director of the Texas Association for the Education of Young Children, and she hails from Illinois, receiving her Bachelor of Science in Child Development, and found her way to Texas when she got her master's in special education from the University of Texas. Mandy is also our very own. She's been at Children at Risk since 2004 and has become Children at Risk policy. In 2006 became our public policy analyst, and now she's the Director of Public Policy and Governmental Affairs, receiving her master's in social work from the University of Houston and her bachelor's from St. Edward's in Austin. Health and Human Services are a priority on Mandy's advocacy agenda. Her experience and knowledge of the Texas legislature has assisted her efforts in achieving quality care and services to Texas' most vulnerable youth. We're joined also by Lauren Hogan, who's the Managing Director of Policy and Professional Advancement for the National Association for the Education of Young Children, with responsibility for a portfolio that includes federal and state policy and advocacy, higher education accreditation, professional recognition, and applied research. She's developed and led bipartisan early childhood policy agenda with a keen focus on centering the voices of educators, shared leadership, innovation, diversity, and equity. So thank you for joining us, and I'll turn it over to Kim.
Thanks, Sharon, and thanks everyone for hanging in there. I know we're running a little long, and after us, we've got one more set of panelists that I know you don't want to miss. So if you can hang in there with us for a few more minutes, we want to give time and space for this conversation as well as the next. So, but we shouldn't be too much over that 11:30 mark. So, Lauren, good to see you, friend. You have been a little bit busy lately. Not that you weren't busy before the pandemic, but ever since the pandemic hit, and right now with Build Back Better. Christine talked about it briefly at the beginning of our time together this morning about this legislation. If you've been paying attention to the news, you've heard these words. But specifically, one, what's going on? What's the latest and greatest? And then two, how does this help us solve this issue that we're talking about today with regards to equity and access for both our workforce and our children and families?
Great. And hi, everybody. I will go quickly because I know you have another panel after this that I know everybody wants to get to as well. And Mandy's great information about what you can do in your state. And I'll drop a link to a webinar that we held with a number of partners earlier this week that folks can really get into the details of what this means. The really, thing to know is that this is the extraordinary and transformational opportunity that we've been waiting 50 years for, and maybe even more. I think, while so many other important investments have been eliminated or scaled back, early childhood education has survived so far with $400 billion in simultaneous support for childcare and pre-K. It's basically a birth to 5 program with 2 funding streams. And I think one of the things it does in terms of the equity piece is really take the field away from the scarcity situation by addressing the issues of affordability for families and compensation for educators at the same time. As I know Dr. Hamilton and some other folks were saying, we have to acknowledge the fact that we can't fund compensation for educators on the backs of parents, and we can't fund affordability for parents on the backs of educators. And that's what we've been doing. This kind of investment addresses the equitable access to quality across all settings, and it is intentionally inclusive of family-based childcare, of centers, of schools, of faith-based. There's so many pieces of the work that can be built in to address that it really speaks to all of the pieces about equity that sort of came through today. Again, I won't go through the details on sort of how it functions, but I would just say for the state to move forward, the thing to keep your eyes on, as with so much around federal policy, is the implementation. There are very important musts and shalls in all of those things in federal policies. States shall do equitable distribution. States must use funds for compensation. But because this country is what it is, there are also a lot of mays. States may do some of these things. And so the work is going to fall on a lot of folks in states to urge the take up of the programs first. And that's going to be statewide if you can, locally if you can't, because there are provisions for making sure that funds can get to local communities, to Head Starts, to make sure that there is equity across states and settings. And to ensure that the implementation is keeping in with the intent. Dr. Granillo, I think, also spoke to this, sort of thinking about, look, of course, family childcare providers can provide high quality. We all know quality is about the workforce, the educator, not the setting that she's based in. Of course, the state can structure its QRIS and its licensing to provide pathways to support family childcare. Of course, advocates can help them address their fears and processes to get through that, but it doesn't always happen that way just because it can. And so the implementation on those pieces matters tremendously. And the last thing I would just say, as you guys are thinking now about preparing for this implementation, we are on the cusp of this incredibly exciting moment where we're going to be addressing, again, affordability and compensation. We're addressing access and supply, in part because we're addressing compensation. That's how we're addressing supply and quality. But thinking about the ARP dollars, and I know Texas is trying to get those out, thinking about now investing in the workforce, like Cody was talking about, the short and long-term investments in wages, in benefits, and in scholarships, so that programs across all settings can take advantage of some of the mixed delivery pieces, so that we're really thinking about, there's going to be a floor of compensation at a living wage that goes up to comparability for comparable credentials. We want to make sure those credentials that folks have access to those credentials so they get access to that compensation within the system that's able to provide it. We've never had this kind of opportunity and this substantial, sustainable investment before. This is it. This is really our moment, and we're just really excited to be able to support states and settings and advocates and educators who are working so hard in getting there.
I know it's fingers crossed, toes crossed, push, push, push. And I know
Cross all of it.
you and the other national advocates have done a great job trying to keep us informed and trying to keep our persons informed, and so they can make an informed decision. One comment and a quick question. The link that Lauren's going to put in the chat that happened earlier this week, I was able to attend that along with a couple other people I know that have been on this call. Take the time and listen. It really breaks down the details and how these things work, and just helping to help demystify what you may or may not heard. It's going to put infants and toddlers out of business and da 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 da. Really take that time to listen to that webinar, because it really helps explain how this system works together to build that. So Lauren, right now there's $400 billion in the bill for both entities. How much is currently the federal government spending through CCDBG?
So it's about 10 billion. And I remember when we were so excited 3 years ago when we got a $2.4 billion increase, and we were all over the moon. 2.4 billion and $400 billion are orders of magnitude different.
Right.
This is what we're like, when we picture the fears and concerns, we got to get in the headspace that there's going to be cost of care reimbursement. We're going to be talking about paying not on market rates, not on what parents can afford, but on what it actually costs to provide high quality care, including compensation. It's a different ball game when we talk about what that's going to mean for families and for educators.
Yep, completely. When we hear the difference, it's mind-boggling. Thank you for being here today. Thank you for your continued work. Mandy, turning to you. Okay, we're in Texas. We have started this race equity work. We have Build Back Better, hopefully tapping on our door. Where do we go from here? What are some steps? How can we've just been energized? How can we get involved for here in our state?
Right. And I'm excited. I'm excited with you, Lauren and Kim and all of our partners today. It really is a wonderful opportunity. And listening to partners today with the expertise and passion, we can move forward. We can't be stopped in where we know we want to go. And there's a lot of things lining up for us. So there are no excuses in my book. Folks across the state are working together really for two major goals. One is to increase access to equitable, affordable childcare, and two, to strengthen the workforce. And there's a couple of ways right now that are very timely to engage in these conversations and for us to hit those goals. In Texas, for legislatively, we have interim charges that the speaker has asked for. And so right now we're submitting interim charges. We're not in session, but during the interim, there's still committee hearings, and that we must engage. The expertise that we've heard around Texas today is the opportunity, now's the opportunity to really engage in those conversations. Also at the state agency level, and I know the Texas Workforce Commission was brought up today, they are working around the clock in regards to implementation of some really good bills that passed last session. And so that means that they're going to have stakeholder engagement conversations. They're going to be making policies and guidelines. Again, the experts that are on this webinar and our friends who couldn't make it today need to engage in that process. And then on top of it, there's billions of dollars, not even talking about the conversation Lauren was having, but billions of dollars that are being allocated right now in Texas for shared services. We were talking about networking, talking about quality improvements, talking about scholarships to support our teachers. These are all things that we need to take advantage of and make sure that our voices are being heard. So that being said, the Early Childhood Education Coalition has work groups. I think there's 5 or 6 work groups that are really strategizing, making specific concrete policy recommendations and gathering data. So I would encourage folks to participate in those conversations if you can. And then also just stay tuned. And I don't know if we can drop, just for people who might have missed, the Texas workforce discussion paper that was currently or recently approved. So people have an idea of what's coming up the pipeline, down the pipeline.
Thanks, Mandy. Lots of good work happening in the federal government, and I can say lots of good work happening here in Texas. The last 2 sessions, we've had very successful sessions based on early childhood. We have the momentum. We have legislators from the top to the bottom that believe in high quality childcare. So the opportunities are here, and we look forward to continuing to work with you. Kaeleigh just dropped the link in the chat for our work group. So if you want to get involved and learn more, please participate. And with that, Sharon, we will turn it over back to you for our last presenters.
Thanks so much, Kim and Lauren and Mandy. We know that racial equity requires healing, not just for communities, but internally for ourselves. And so as we close out, we want to put the attention on ourselves, and we know that we're in the business of caring for others. And so this is challenging work, and we have to do the work individually and to look inward as well. So with that, I want to introduce our next speakers, Kathleen Krabs and Sterling Freeman from North Carolina, where they are co-founders and principals of Counterpart Consulting. Kathleen Krabs is a leadership and equity educator and coach, and a partner in organizational and cultural systems change. She collaborates with people and groups to clearly hear themselves and hear each other, and creates strategies to partner and move through the world with clarity of purpose and commitment to justice. I also welcome Reverend Dr. Sterling Freeman, who is a leadership coach, organizational and cultural change agent, facilitator, counselor, and public speaker. His work is grounded in an equity lens motivated by a desire to achieve justice. His more than 25 years of experience have equipped him with knowledge and skills in idea development, project management, personal development, goal clarification, and formal and extemporaneous speaking. So welcome, and thank you for your participation this morning.
Thank you. Thank you so much, Ms. Jones. We really appreciate that. I am Sterling Freeman, and I am here with my colleague, Kathleen Krabs. And we want to say thank you first to the team at Children at Risk. We take it not for granted that many others could have been here to be with you today. And so we're grateful for this time. I also want to just say to those panels that Kathleen and I had an opportunity to listen to for the few moments that we have been on, and just want to say to you that you have been our teachers. And just these few moments, we're grateful for what you have shared and all the work that you do. To those who are assembled in this conference on today, we want to say that we are delighted to be with you. We want you to understand it is our honor and privilege to be speaking with you for these few moments to culminate what we know has been an informative and challenging morning. We know that you've heard from the experts already. So Kathleen and I feel a bit like interlopers on today, but we want to say that we hope we might just provide some encouragement as you go along the way. We hope that you have been inspired today. We hope that you who work every day to pour into the lives of our children are on this day inspired by those who have stopped along the way to pour into you. You deserve it. Today, you have been reminded that equity does not trickle down, but rather is a radical project that begins at the sources of barriers erected to wall our children off from the realization of prosperous lives. Equity starts at the roots. Today, you have been reminded that equity requires a closer look at the subtlety of the many machinations of how race is operating to make the vulnerability of our Black and brown children inevitable. Equity starts with research. Today, you have been reminded that the cause of equity is held in the hands of people with their hearts and minds stayed on the well-being of our children, and in whom we must invest to secure our future. Equity starts with the early childhood workforce. Today, you have been reminded that the care of our children must be within the reach of all parents and of the kind that would meet the needs of and therefore be equitable for families who are at different stations in life. Equity starts with access to quality childcare. Today, you have been reminded that equity must find its footing within the collaborative action between the genius of those who are confronted most by inequities and those who have the power to implement vision for justice and liberation. Equity starts with informed policy. And as you draw closer to the pause of this Equity Starts Early gathering, we want to remind you that equity starts with you. So after having heard from your colleagues who are plowing pathways to equity in childcare and early education, we challenge you to start with you. Look deeply into the face of the risks you will take and see the faces of the children you serve. Lean into the discomfort you have been feeling so that the way for children might be made easier. Set free the truth that remains lodged in your throats by the clutches of fear, so powers that be may know the well-being of all children is non-negotiable. Unleash your imaginations and make paradox your playground so that the third way and fourth way and fifth way and 100th way can be made for children to prosper. Understand the opportunity that lies in white colleagues stepping up to dismantle and BIPOC colleagues bringing their wisdom and vision as those closest to the harm of structural racism. Decide how you're going to be different to help transform your sector and the lives of children and therefore our country into something we have never seen before. Equity starts with you.
We believe in pacing work and being mindful of our health and wellness as we work. And we commend that to all of you who have children and families at the center of your consciousness and your lives every day. We are grateful for you. We're grateful for your diligence and your work and your seeking of equity in every corner of your work. And we want to close, help you close today with some breathing and some peace and some meditation to honor that work and to honor you all who are doing that work every day. That is equity as well. Self-care is equity. So we're going to invite you to center yourself, however you do that physically. Feel free to close your eyes, focus on an object in your line of sight. Take a posture that will allow you to breathe freely. And take in a deep, deep breath, counting to 4. And release that breath to the count of 4. Let's do that 3 times. Keep breathing evenly. Be mindful of your inhale and your exhale. Feel your breath move throughout your body. Begin at the crown of your head, then through your facial muscles. Keep breathing. Feel that breath down your neck, washing over your shoulders, releasing any tension there. As you breathe, feel your breath as it fills your chest and your abdomen. And experience that breath running through the extremities, to the tips of your fingers, to the tips of your toes. Through your breath, open yourself up as a repository to take in all you've learned and experienced today. Use that breath as the channel through which you will act on what you've learned and experienced today. And as we finish our meditation, think about one aha, one insight, one commitment you have as we move forward into the busyness of our lives and the gifts you've received from the panelists and the conversations today. Early education advocate Denisha Jones simply says this: I might sound Pollyanna-ish, but I believe early childhood education can save the world. We believe that too.
Might we all have such prodigious and large and courageous and daring hope as that expressed in the words of Dr. Jones. We can change the world for the sake of our children and for our sake. And for that of this land, so many of us try valiantly to love. We certainly hope that we can have such hope. So as you are reminded today of all of the ingredients that go into the making of equity-focused culture, context, and practice within the child care and early education system, let it not be forgotten, and may it remain a disturbing and inspiring clarion call that summons you to the cause each and every day that equity starts with you. Thank you so much. We're grateful to have this time.
Thank you so much. And how beautiful that is, that self-care is equity. I'm just floored. Kim, I know you're feeling the same way.
Yeah, totally. I love the disturbing and inspiring. And Sterling and Kathleen, thank you so much for your insight with us. It was a great way to end our time together today and begin our work and begin our journey together as a state and as a community of early childhood people who, no matter what you do, if you are in the trenches with children and families every day, supporting our workforce, educating our workforce, or advocating, or a parent, or just a child at heart, and remember how important those early childhood times were for you and your life. Let's continue this work together.
I think I'm going to wake up every morning and say that I'm going to make Paradox my playground.
It's a good thing.
So as you can see on the screen, if you want to connect with us and learn more about what we're doing at Children at Risk and more about who our partners are, please avail yourselves of that information. This was the last virtual event of this kind for the year for Children at Risk. So please visit our website to learn more about the exciting things that we have planned for 2022. And I think we had a slide for the survey, because we always want to be better and better at what we do. Please take the survey and help us to bring you programs that impact the work that you're doing and that help children.
Thank you all for joining us. That concludes our time together. Thank you for those who stuck with us for 20 minutes. I guess it was ambitious to think we would be able to squeeze everything in 2 hours. 2.5 would have been better, but that's okay. Thank you again. There is a recording of this that will be sent out to those who registered. So again, thank you for being with us, and we look forward to more conversations in person and via Zoom as we go into 2022. Be well, be safe, stay warm, and we'll talk soon. Bye-bye.
Bye-bye. Thanks a lot.